Okay, ma'am. Good evening, everyone. This is Dr. Tamina Sheikh. I would like to do a warm welcome to all participants, our guest speaker, on behalf of All India Homeopathic Students and Youth Association. ICR presents International Ayush Conference 2025 and Ayush Youth Festival 2025 on 12th of January 2025 at Kolkata. Please enroll yourself, and we are eagerly waiting to welcome you all to this event. We have options for online and offline both. Detailed description is available in our WhatsApp group. If you need any assistance regarding this seminar, please do not hesitate. We are just a call away. And today, I would like to introduce our guest speaker. I am honored to introduce Dr. S. Kiruthiga. She is a gold medalist in MD Homeopath and pursuing her PhD Homeopathy. She is an associate professor at Savraj Homeopathic Medical College in Salem, Tamil Nadu, in the Department of Materia Medica. Affiliated to the Tamil Nadu Dr. MGR Medical University in Chennai. Ma'am has done drug proving in efficacy of Trabulis terrestris in the treatment of urinary complaint. Also submitted amazing multiple research paperwork with great results. He has been awarded at university level as Best Researcher Award by Rajiv Gandhi Institute of Biotechnology. Also been felicitated by Kerala Governor at International Ayush Summit, Kanyakumari. Also, ma'am has already conducted 50 plus webinars and compelling question papers for All India Postgraduate Entrance Test in Homeopathy. Sorry, assisting in publications, services of research articles, and thesis. Dr. S. Kiruthiga has done her advanced course in autism from the Other Song International Academy, working with autism children with regards to counseling and homeopathic treatment. Hence, this is a great opportunity for us to hear from Dr. S. Kiruthiga about scope of homeopathy in autism spectrum disorder. Am I audible to you, ma'am?
Yes, I'm audible.
The stage is all yours, ma'am. We would love to hear from you.
Yeah. Very good evening to all. Instead of spending your Saturday night with any amusement, you're all here. I hope I'm audible. So you're all here to learn something today, and that gives me a lot of motivation. I hope I'm not going to disappoint you. We'll be having a lot of takeaways at the end of this webinar. So without taking much time, I'm going into the seminar. Yeah. So let me share the video. And could you please guide me to share my screen? Yeah, got it. Yes.
Ma'am, there is a option to share next to the
Yeah.
audio.
Okay, share the screen. I've made it share the full screen and
Let me know once you share the screen because right now the screen is not visible.
okay. Select window or screen. Yeah. Am I visible?
It's loading. Just give few seconds. Yes, it is audible.
Yeah.
It is visible, ma'am. Yeah.
Yes. I share the slides. Okay. Um, Thanks for the wonderful introduction, and I'm thanking Homeopathy 360 for this wonderful platform with which I can help the students and practitioners and all the dignitaries. I welcome you all once again. So we go to the topic today: a scope of homeopathy in autism spectrum disorder. So before knowing the scope, let's see something about the trending disease, autism spectrum disorder. So it is not a psychiatric disorder. It is a neurodevelopmental disorder and it is usually identified below the age of 3 years. So why we are talking more about autism today? You must be listening a lot of videos and cases and all, because the incidence is very drastically increasing nowadays. Earlier it was, I could say, one case in 10,000 children, but now 1 in 250 children are in India is being affected with autism spectrum disorder, and earlier it was found as a disease of Western countries. Now in India it is also spreading a lot. So, and when we see the statistics, we found that it is very, very predominant in the male children, especially in the firstborn. And when we talk about the causative factors of autism spectrum disorder, all I had know that it was a vaccine disorder. That is how we were taught and we have heard everything. But beyond vaccination, there are multiple factors contributing to autism spectrum disorder. And the most pitiful thing is that so far no cure has been available for autism spectrum disorder, and that makes everybody very desperate in researching, in analyzing about autism spectrum disorder. So why we call it as a spectrum disorder? We all know spectrum means which is a combination of multiple colors. So in any disease, for example, if somebody has pancreatitis, will be having the symptoms of pain in abdomen, vomiting, fever, all the symptoms that is pertaining to pancreas or pertaining to the GIT. But when we see autism spectrum disorder, the symptoms are at a various level. I could say mainly four components. The first component, it is about their language and speech. The children has difficulty or delay in speech. Even if they speak 1 or 2 words only. And sometimes they repeat whatever we say, but they don't know exactly what are they speaking. You know, the meaning, the content, they doesn't know properly. And the second area is about cognitive development. And the third area, we could say sensory issues. Sensory issues means, they'll be keep on insisting, I must wear only red color shirt. So I will be going only on the left direction, not in the right direction. If they are going to school, they daily want to go in the same road. They don't want to change the roads. So like that, there are many areas of involvement in autism disease. That is why it is called as a autism spectrum disorder. So the areas, I could say, communication. They don't want to communicate with anyone. They prefer to be all alone. They just want to be left alone. Even they don't want to be looked at. They will be keep on involving in their own activities. And there is poor development of language. As I said, they just repeat. And cognitive areas, it is about understanding. So some of the kids, they don't even recognize their mother. And many parents, they used to tell that, doctor, I'm not expecting too much. I'm expecting my son to call me as ma, amma, like that. Okay, so they have a problem in the cognitive areas also, and sensory issues, which is mainly they don't touch the sticky food and all. They don't like to wear some sort of dresses. All these, a group of symptoms which make autism is a very complication disorder to identify and to treat. So again, along with the symptom pattern, the autism contains four types of disorder. So according to the DSM diagnostic criteria, this criteria is used by American Psychiatric Foundation, and they have classified symptoms for almost all the psychiatric disorders. And for autism is a combination of four disorders. We'll see one by one. The first is autistic disorder. So it is usually identified at a very young age. I could say below 2 years itself. From birth, the child will be having some symptoms. It is otherwise called as infantile autism and childhood autism. As a homeopath, I didn't receive much case from first category because they don't readily approach homeopathy at once the diagnosis is made, or sometimes the diagnosis is not made very earlier because they'll be thinking that my child will be speaking delay. They may be speaking after 3 years, they may be speaking after 4 years, or like that. They'll be waiting and waiting. By the time we pass out this sort of diagnosis, and it is some now because of this awareness and all. Some of the families, they are identifying autism disorder at a very early period. So usually younger children, and I could say we have a lot of scope in homeopathy while treating the autism disorder, this infantile autism. So how they identify, what are the symptoms they will identify means mainly sleep disturbances. The child doesn't sleep even from the first 2 months they were born. So it is very difficult to handle the neonate. They'll be crying all the time. They are not comfortable with anybody. The mother lives, the father lives, and they'll be taking the child here and there, but they are not happy with anything. They will be always showing some sort of restlessness. That is the main identification or diagnostic symptom of first type autistic disorder. And the
Sorry to
second,
interrupt, ma'am. Sorry to
yes,
interrupt,
please,
ma'am.
yes,
Actually, slides are not moving, ma'am. Can we have the slide show, ma'am?
yeah, it is like now
Actually,
where.
it is the first slide only we are able to see, ma'am.
Oh, okay. Can I make it in a
Now
different
it is
now?
moving, ma'am. Yes, ma'am. Now
Okay.
it is moving,
Then
ma'am.
I skip the slideshow pattern. Okay.
Okay, ma'am. Thank you, ma'am.
Yeah.
Ma'am, you can also
I,
click uh, on the top. You will see from current slide. Just click on that,
okay.
and the slideshow will go on.
Yeah. Earlier also it was going with. Yeah. Now.
Okay. Yes, ma'am. You just need to select the slide. Then on the top left and right hand corner, you will see
Yeah.
from
I've
current
I've
slide.
selected. I've selected
Oh,
the from current slide.
okay, ma'am.
Okay. Is
Yes,
it
ma'am.
moving now?
Yeah. Yes, ma'am. Thank you.
Yeah. Okay. So the second category, it could be called as a classical autism because the children are very well, they are able to speak also, and they are able to walk, travel, all their milestones are very, very normal. So nobody will suspect that this child is having autism. So as the age progress, after 3 years and 4 years, when they started going to school, they will found that the child has difficulty in grasping or understanding whatever being taught in the school, and they have difficulty in mingling with the other children of the school. So they may not have any friends and all, and it is very difficult for them to sit in the classroom and mingling with people. And as they grow older, these children are more prone for some psychiatric disorders like anxiety, depression, and they'll be showing selective mutism. Selective mutism means they speak only when they want. They come to the mother, they'll ask for food, they'll ask for water, or whatever is their requirement, they'll be talking about. Otherwise, the child remains always muted. So the third category, it is pervasive development disorder. I could say we can compare it with the Barreta Carp child. In pervasive development disorder, along with the autism feature, we will also have delayed milestone. So everything will be delayed. So parents will be waiting that my child started walking at the age of 2 years. Let me wait for some more time. The speech will be delayed. I mean, the speech will be developed later. So they literally waste the time up to the 4 years, and then they meet the doctor and they get the diagnosis. So that is pervasive development disorder. And in my study, I found that it is little bit difficult to handle these cases because these children are very, very poor in their daily activities also. They don't know how to wear the dress, and they don't even convey the urine stool reflexes. And it is very handled. These children, even sending them to the normal school, play school, that is also very, very difficult. They are very, very dependent also. Whatever being taught to them, they forget, and it is a very difficult task to handle and treat this pervasive development disorder children. And the next category is childhood disintegrative disorder. So typical history, they'll be telling that my child was very, very normal up to the age of 2 years or 2.5 years. And afterwards, they slowly lost their speech. Until 2 years, the child would have told all the rhymes, whatever the common rhymes which, twinkle, twinkle, little star. The child was very, very cheerful and very, very studious, very good. Their milestones were very normal. But from the age of 2 years, the child started going back. Some children, they even forget their parents also, and eating patterns, wearing dresses, everything. They start forgetting slowly, and then they start approaching the doctor. And in this case, loss of eye contact is the most predominant symptom in childhood dysagregative disorder. So for a homeopath, we need to categorize these types of autism just because you can choose the remedy accordingly. So, but we don't have to pay much attention into the types and all. So causative factor, as I already told, even I was also believing that it is vaccines that is producing autism, because this childhood integrative disorder, it is identified at the age of 3 years or 2.5 years, and MMR vaccine, which is being given at the age of 1.5 years, I could say at the age of 18th month, that vaccine is being given. So everybody is thinking that after the vaccination, my child is going back and my child has developed autism. But it is not like that. After seeing 120, 130 cases, I'll be able to understand that it is not about the vaccine, it is not about the medications. They play a vital role, but still the main reason for developing autism is it is about the mother. It is purely about the mother. The consequences that were faced during the antenatal period, that plays a vital role in developing the child and all. So mainly, there are few factors which is being confirmed in my study also. Hypothyroidism. So if I take out of 50 individuals, 12 individuals had hypothyroidism. Either they are hypothyroid even before the pregnancy or during the antenatal period. We call it as a gestational hypothyroidism. So that leads to developed milestone in the children. And the second case, diabetes mellitus. Usually in antenatal period, diabetes is handled with the insulin only. Medications are given to very less people. Otherwise, the insulin shots are very common. And then hyperemesis gravidorum. Until they are going to the labor ward, up to the 9 months, the mother had experienced hyperemesis gravidorum. So this is one of the commonest thing which I found in many cases. And history of IUD, this I can relate. The mother who is trying to conceive, they were 5 months or 6 months pregnant, and the child died within the womb. IUD, within 6 months of the previous IUD, if they get pregnant, they obviously developing autism. So it is better whenever there is a intrauterine death, it is better to treat the mother with some homeopathic medicine and give some space, at least a period of 1 year. That will really help for the future progeny. So instead of rushing to get pregnant in 6 months period, they obviously end up with the autism case. And antepartum hemorrhage, it could be in the 3rd month or 5th month, it could be 1 day or 2 days, anything. So in many of the women who had antepartum hemorrhage, the children are having some problem in the neonatal period. Like the moment they born, they have lot of complications, and that complication leads to development of the autism spectrum disorder. And in 6 cases, I found that there is a fever, and undiagnosed fever, PEO, pyrexia of unknown origin. So they had fever at the 5th month, fever at the 7th month, and the fever lasted for 1 week, 10 days. They don't know why it had happened, and they were treated with a lot of antibiotics. And during that period, proper nutrition was not given to the mother, and all these things leads to development of autism spectrum disorder.
Ma'am, I'm sorry to interrupt. The slides are
Please.
not moving right now.
Now,
No, ma'am. Can you please close this and reopen it again?
yeah, I do.
Yes, ma'am. Now the slide has been changed.
I closed it. Okay.
Okay.
Mm, just a moment. Excuse me. I'm working on it. Sorry for the interruption.
No problem.
Is it possible to share from your side, ma'am? Because it says select window. Box. Mm.
Okay.
Is it visible now?
Yes, ma'am. It let
Okay.
it.
I think
No, no,
this
it is gone.
mode is working well. Sorry.
No, now it is gone, ma'am. It just came for a few seconds and now again. When you click on share screen, and you can
Huh?
click on entire screen.
Yeah. 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 Yeah.
Did you click on entire screen?
Somebody is raising hand. Yes, ma'am. Entire screen. And then now.
And then, yeah, you can select your file. Yes, ma'am, I can see your screen.
Okay.
And now you can present it.
Um, so can we go with this mode, or you want me to slideshows?
Yes,
Is it
ma'am.
visible now? Okay.
Yes, ma'am.
Thank
The
you.
slideshow is visible. You're welcome.
Okay. Okay. So this is what I found in the antenatal comorbidities, and whatever I have mentioned here, these are major components seen in most of the cases. But along with this, there are few cases reported with the complaints of umbilical artery block. That umbilical artery block that lead to poor blood supply to the fetus, and that leads to autism spectrum disorder. And there are some common traits like elderly parents, the women who have conceived after 35 years and who already had some endocrine disorders, and so in few cases there are fibroid uterus which had complicated the pregnancy and which was increasing in size during the antenatal period, that also ended up with autism spectrum disorder. And when there is a family history of autism, when one child is being affected with autism, obviously the sibling has the chances of developing autism. And also autism is found in the paternal and maternal relatives also. So these are certain guiding factor to think that the child may be having autism. So now we see the what are the early signs of autism in children. This is very, very important for the practitioners, caregivers, and all the parents to know about these illness, because the early detection, it is really helpful in developing the children in a very productive way. So when the parents are coming at the age of 7 years or 8 years for treatment, it is very, very difficult to produce a change in them as we are producing changes in a 3-year-old or 4-year-old child. So diagnostic features, even though there are many types of autism, there are a handful of a collection of symptoms. The three cardinal symptoms I always ask with all the children. So these are very, very useful in diagnosing that it is a case of autism spectrum disorder. In the second category, Asperger's syndrome, the child will be speaking. So we may think that it is not a case of autism. Maybe it is a case of some temper tantrums, or it is a case of ADHD, attention deficit and hyperactive disorder. So to differentiate from all the other illness of the children, we need this cardinal symptoms. So whenever a child comes, you ask them about the eye contact. The mother will be saying that, sometimes he looks at me. Whenever he needs something, he comes and looks at me. So if I hold the face of the child, he will be looking at me and telling some rhymes and all. So this is the level of eye contact in the autism children. And in your clinical setup, you cannot see the child sitting in your clinic and speaking something. They'll be running here and there, and it's very, very difficult to get the eye contact. The second thing is no response to name calling. So you call them 5 times, 10 times, they don't give any response at all. And some children, they give response to the mother's voice or father's voice, maybe because of the familiarity. That too, when they raise their voice so much, if they call loudly, then the child will be responding to the name calling. Otherwise, as a first, as a first timer, when they come to your clinic, you are calling them and they will never respond to your name calling. And the third thing, most of the presenting complaint. So why parents are approaching to the doctor is delayed or no speech only. Because eye contact they don't bother about. And if the child doesn't look back, they call them 3 times and 4 times. They don't find all these symptoms as an alarming sign. The most alarming sign for the parent is the child is not speaking properly. Because only when they start speaking, they can be put up in the school. So at the age of 3 years or 4 years, if the child is not speaking until then, they'll obviously approach the doctor for this diagnosis. So along with the three cardinal symptoms, they are diagnostic tools, I can say, repetitive behavior. So this repetition can be anything and everything. In every children, it is entirely different. So I could give you some examples. Some boys, they used to come, they'll be keep on playing with the thread. They'll be taking the thread and they'll be doing something the whole day. If you leave them alone, they'll be doing and doing. And the other category, they will be arranging things. It could be arranging the shelf or it could be arranging the books, and especially they'll be arranging their toys. If you left them alone for 4 hours or 5 hours, they don't even come and ask for food. They will be sitting and arranging. If we try to do something with the arrangement, they'll become very angry and they'll be showing the tantrums. So this is one type of repetitive behaviors, and I've seen very strange things also. A boy, he was coming, he was making noise in the wall, he was making noise in the floor, and he's putting his ear over there and try to listen. I don't know what he was trying to listen, but he was always touching and making noise. Everywhere he was making noise. Some children, they'll be making some hand movements, repetitive hand movements. So there will be a pattern you could able to see. There is a pattern in them. They'll be repeatedly doing it. And sensitive to noise for the mixie, grinder, and cooker whistle, uh, crackers and all. These guys are very very sensitive, and some of them even for the mobile ringtone. They'll be closing their ears. They don't want to hear all these things. So sensitive to noise is another factor. And then isolation. So there will be a crowd of people sitting in the hall and speaking about something, or a TV maybe in the high volume, but he don't mind about anything. He'll be just lying down and doing his arranging work. So this isolation, and they don't try to mingle with people of their age group. So this is called a social behavior. And when this social behavior is being affected, parents will be approaching the doctor. And then hyperactive. It is very, very difficult to, make them sleep by 10
Ma'am, I'm sorry, you're not audible.
wedding, some parties are there, they are going to mall and all. It is very, very difficult to handle the
Ma'am,
children.
sorry to
And some
interrupt.
parents reported that, yes, ma'am.
The
Sorry?
screen has stopped, and I think you lost the connection for some time. The screen has been disconnected. Please
Okay.
share the screen once again.
Mm, So you want me to share once again?
Yes, ma'am.
Yeah. Okay. But it says, does it require frequent change of lives?
No, ma'am. Actually, your network got lost, due to which you were not audible, and then the screen sharing was stopped.
Uh,
Yeah.
mm. So is it
Yes, I
visible
can.
now?
Yes,
Okay.
ma'am. Thank you.
So along with that sensitivity to noise, the children will be having, hyperactivity, which is very, very difficult to handle by anyone. They'll be running here and there all along, especially in the outdoors. And most of the children being complained that they lost somewhere. Even last week, they told some child, she was checking the clothes in Max and the parents lost them. So they were trying and trying, and then with the CCTV footage, they found the child and they went home. So this is very common with this autism spectrum disorder. And then tantrums. If they want something, it must be given at once. And if it is being delayed, they'll be showing any sort of tantrums. And some of the child, they don't even have this sense of pain at all because they fell down. There will be bleeding. They don't even come and inform that I fell down, I have pain or bleeding something. So this is another sensory issue we will see with the autism children. So altogether, I can put up the clinical features. So the cardinal features are poor eye contact. They don't respond to your name calling, and they'll be repeatedly they'll be in their own world. They don't give a respond to us. And poor sitting tolerance, it is very, very crucial because most of the school, they don't accept the children because they'll be roaming here and there and disturbing other children also. So this is very, very, very difficult for the parents to keep them whole day at home. Just for a relief, they want to send them to either therapy or for school, but it is very difficult for the child to handle the crowd, and it is very difficult for them to cope up with the rules of the society. And obviously, they don't inform their urine and stool reflexes. Most of them, they wet their panties, and they'll be doing it in until the age of 6 or 7 years. There are many kids, they are wearing pampers at night, up to until the age of 10 years and all. So these are all something we really have to check, and we really have to help parents in this. And sleep disturbances, as I already told, it is very erratic pattern and difficulty in identifying people. So in a crowd, they just go away. They don't search for father or mother. They don't have the fear of being lost also. And whenever somebody comes to home, relatives and all, they don't even recognize any of them. And this monomania. So this monomania, it can be applied for repetitive behavior also. And stubbornness also. If I want something, you must give it to me. They won't settle until they get it. So they'll be doing all the tantrums. And as I told, if I am going on one side, I must be going on the same side. Some kids, they are having a ritual. For example, they go to therapy. While returning from therapy, every day they want to go to that particular bakery or tea stall. They want to have the food, and after coming home, after parking the vehicle, they must go around the vehicle like that, and then they will be coming home. And if you are in a hurry, if you are taking the child without going to the bakery, then they will be doing the tantrum the entire day. The whole day they'll be doing tantrum. So some sort of rituals are very, very common. In another kid, somewhere something is stuck in his tooth. He had taken it, but still he's doing the same gesture for the whole day and for 3 to 4 hours in the classroom. He is, taking his hands and putting it in the teeth as if trying to pulling it out. So these kind of same set of behaviors, repetitive behaviors are very, very common in autism children. So now, what is the current scenario of autism spectrum disorder? There is no definite measures to diagnose the autism. However, investigation you do, including MRI brain, we will not be finding any sort of pathology in the brain or nervous system. So there is no specific tools for diagnosis. As I already told, it is with their behaviors only we are going to diagnose the disease, especially the cardinal features of autism. And there are some severity scales. These scales, parents are not that much, no, they don't know the actual state of the disease. They take time, they delay, they don't want to spend more. So most of the parents, they refrain the child from speech therapy and occupational therapy, considering the expenses, or they'll be thinking that my child will be all right. In villages and in uncivilized communities, they are thinking that my grandfather spoke after the age of 4 years, so it is fine. My child is only 3 years. I can wait for another 2 years for my child to speak. Like that, they will be postponing the treatment. So, in order to give awareness to the parents and to know the duration of the speech therapy and occupational therapy, there are some autism severity scales are there. And another scenario, whether we have to put the child in normal school or in the special school. This is another decision they have to make. So in order to compile with all these things, there are scales have been designed. The scales are nothing but a set of questionnaire. So there will be questions comprising the all four areas. Like as I already told about their speech, what is the age of speech development, whether they are repeatedly uttering any words or they speak only at home, they don't speak in the outdoors. Like that, many questions have been derived in the scales. So ISAA, Indian Scale for Autism Assessment, this is the most accepted tool today for analyzing the autism children. And Kara is another scale, but Kara, we need the input from the caretaker also, parents also, and from the school also. The questions are designed like that. With ISAA, it can be made with the observation of the physician and with the parents. We can come to a conclusion and we can fill the questionnaires of ISAA. And whenever there is a family history of autism, the child is being diagnosed very earlier, I could say, because we suspect already there is an autism children in the family. So at the age of 2 itself, they will start diagnosing that it could be autism. And signs and symptoms by educating the parents, parents in the sense even before they become parents. I would say premarital counseling will be very, very helpful uh, for the better development of the child also, and identifying these disorders also. So only with the signs and symptoms we are diagnosing autism spectrum disorder. Good. Ma'am, is it going good? No. Yeah. Um, am I audible now?
Yes, ma'am, you are audible, ma'am.
Yeah, yeah. I'm sharing. So between where we left, is it visible now?
Yes, ma'am. It is visible now, ma'am. Yes, ma'am.
Okay. So when it comes treatment, there is no specific treatment is available. Only thing we can modify the behavior of the child, based on the whatever outcome comes that is being treated now. And this medical management, it is about the other disorders which has been find along with the autism. For example, these guys doesn't take water or fiber food properly, and they'll end up in constipation, and they will have recurrent respiratory tract infection. So this stomach upset, colic, respiratory infection, and sometimes epilepsy also. Those diseases were handled with medicine, but there is no definite medication is being available for autism disorder. And alternative and complementary therapy, homeopathy is not mentioned under this. They are talking about diet therapy. We could change excessive carbs. The children are not supposed to take, the seasonings, Ajinomoto, oregano. That seasoning has to be avoided. Seasonings made them more and more active, like hyperactiveness can be reduced by avoiding the excessive carbs and the seasonings. Also, they are asking the child to refrain from taking milk because casein, it is difficult to digest in autism children, and that produces some sort of irritability and behavior issues. And music therapy. In few cases, they said that music therapy is very, very helpful in developing speech. And also, this is very, very important. As a practitioner, we should not miss any child having this disorder. It must be watched and diagnosed at a very early age. That will be helpful in improving the child's life. As age progress, the nervous system would have been developed completely, and we cannot do much intervention in that. And when we see the adolescent autism child, they'll be started looking around the society. All others are speaking, but I am unable to speak. If the speech is not developed, all others are able to study something, they are able to secure marks, but I cannot do anything. So these things makes them very, very anxious. And if the child is speaking, it is fine. At least they'll be telling that I'm feeling anxious, but most of the children are muted. So in order to show the anxiety, they start bullying. They don't go to school. They don't eat food, and they will be started beating the caregivers. There are many children being come to treatment just because they beat someone in the school. They beat the caregiver and they pushed them like that. And most of the children are very, very dependent with autism. Like up to the age of 15 or 16, somebody has to help them in doing the daily activities. So if it is not treated properly, epilepsy is being encountered at the age of 16 years and above. If the child is not developed properly, epilepsy is one of the most important comorbidity. So these are all general scenario, whatever we have seen, but in homeopathy, the scenario is entirely different. So if you want to know better about autism, whatever I have put up in words here, if you want to see, you could watch these two movies I suggest. Autism the musical. It is about 4 or 5 children. So they were training for a musical concert, and this autism sequel after 12 years, how the how the children have been changed in their life, how much they have improved in their autism patterns. So these two movies will be helpful to you. And when we talk about the prognosis of autism, it is not all the autism children are astray. Some of them are performing better. So Temple Grandin, it is a biopic of the Temple Grandin, and she was born in 1947. She had autism spectrum disorder, but still somehow she overcome that. Maybe the severity was less. She overcome that, and she had contributed a lot in the development of animals and other people. Okay, so now a scope of homeopathy in autism spectrum disorder. It is not only in autism. Everywhere we will be checking the behavior patterns. So I could say homeopathy has best scope in autism. By the time I started learning about autism, just I take few minutes to share my story about it. In 2023 February, I had seen only 2 cases of autism. In my 15 years of career, I had seen only 2 cases of autism. by 2023 February. So one of them, they just left me taking the treatment by telling that, the boy, he was 16-year-old, the boy beaten the caregiver and she got fractured hand. So the school told that we will never take up your child again. It's better you go give him some psychiatric medicine, you make him dumb and you keep him at home and do whatever. So this was very difficult and the parents approached and asked me whether we could do something, to change the behavior of the child. So I was trying and trying, I was trying to work out, but unfortunately, I didn't have much time and I was unable to change the pattern of the child. So they stopped taking treatment, homeopathic treatment. But that was, I started feeling guilty, like why I was unable to help with all these 3,000 remedies I'm having, with all the literatures and why it is very difficult for me to treat such children. And then I joined the advanced course in autism, which was conducted by Othersong Academy. Fortunately, maybe I have to do something for these children. The moment I started taking the case, I was also given lot of patients of autism also. So side by side, I had learning also, and I was able to put up in the this thing, in the practical also. So by the last month, I got 60 cases of autism in the month of April 2023. So in 60 cases, I was desperately reading this and that, and finally, even single success, couple of cases, if I am treating them well, that boosted up me and I started learning more and more and more about me. Sometimes I felt most of the autism trait are with me also, because I used to be sitting idle and referring all the time. I don't take food with hands. I will be eating with spoons. The sticky things I don't like. I prefer noodles kind. So like that, I was totally into it. So then I come to know that homeopathy is the only system of medicine which can help the autism children. So in this journey, I changed my PhD project. Earlier, I had taken anemia, but after seeing success in autism, I changed the topic in overnight. I could say in overnight, I prepared another synopsis and I got approved for autism spectrum disorder for my PhD thesis. So today's webinar, my main motive is I would like to tell you all that it is only homeopathy that can help the autism children. Yes, it requires some time to grasp the pattern of autism and to treat the children, but definitely you will succeed in your journey if you are putting your blood and sweat into it. So because of the holistic approach and because of addressing the behavior pattern, homeopathy can help these children very much. And as we all know, homeopathy does not have side effects. So maybe there will be a delayed prognosis, but it is very harmless to children. Nowadays, most of the people approaching homeopathy, even with, even for neonates, they are coming. For 3 months old, 5 months old, they are coming. And because of the introduction of 50 millisimal scale in my practice, because from the month of April, I started treating autism cases. There were success, but I thought that somewhere I stuck with. And in the month of September, I could say, I went to Agra with the help of Dr. Pradeep Kumar Gupta, sir. I've introduced a 50 millisimal scale in my practice. And from that moment, the children have started speaking in 40 days and 60 days, which I never dreamt of. And I don't know, any system can do it. But satisfaction that I'm helping the parents. Their situation is very, very desperate. They have to take the children to 4 to 5 classes in a month. The expenses will be more than 10,000 for handling a special children with minimal result. That is the most important thing. Even after doing all these things, they are not getting much results with the therapies. So then once in a while, children will be showing some temper tantrums and they will be turned to the physicians. And in my journey, I had a psychiatrist who is working in a government hospital. So he referred me one case, and that case, she gave lot of improvement. And afterwards, he would have referred me almost 14 to 15 cases. And Another thing, I have not seen any of them personally also. It is only video call because they are living far away. It is difficult for the child to bring to my hometown, I mean, to Salem and getting treated. So I'm seeing them online only. They are updating then and there on daily basis, on weekly basis. So the results are excellent, and it is very, very difficult to be, getting cases from allopathic school. So in that way also, I'm very much, blessed, and the journey is going good. So homeopathy is the best choice for treating autism spectrum disorder. So it cannot be simply said by words. I must show some proofs, right? So whatever symptoms we are encountering in autism spectrum disorder, like I said, monomania, everything. We have hundreds and 200s of rubrics is being found in the synthesis repertory. So when I started treating the cases, I don't know which symptom I have to take because everything seems new to me. A child is tapping the floor, another child is playing with the thread, another child is arranging the toys. Everything is new to me because I have not encountered much cases. So as a beginner, I was totally relying upon the repertory. I used to synthesize repertory for my study also. So I was able to see all the symptom of autism. So mind monomania, dislikes for clothes, wants to throw away. This exhibitionism, which we studied in Hyoscyamus niger, that is found in the adolescent autism children. They'll be they don't like to wear the dresses, and they'll be handling genitals all the time, that too in front of others, but not all of them are coming under Hyoscyamus. That is the beauty of homeopathy. We have a handful of remedies for every symptom. So this mania kind also, striking himself, they are injuring others and injuring themselves, aggression, sensitive to noise, and persistent thoughts means that child will be keep on insisting. You take me to exhibition, you take me to exhibition. Until they take them to exhibition, they don't sleep, they don't eat and all. So mind obstinate and wandering, desire to wander, restlessness, children in. These are commonly used rubrics in my practice. And when we come generalities, we have seen 4 categories of autism. In the third category, pervasive development disorder, I used to take these 2 rubrics: generalities, development arrested, and development arrested vaccinations from for the 4th category, because we saw regression. My child was very much normal until the age of 2 years. Just after 2 years, she started developing all these symptoms. So for that, I've included this vaccination history and allopathic medicines, abuse of and oversensitive to. These 2 rubrics were used in the history of excessive medication in the antenatal period. And when the child was born, they have been kept in incubator for a long time. And they have jaundice also. For neonatal jaundice, which is lasted more than 15 days and 16 days, you can use this rubric: general medicine, allopathic, abuse of. And generalities, food and drinks. This is my most favorite rubric because even if I don't see any symptom from the child, I'll be asking what are their cravings. So this is the entry point in my treatment. So with this food and drinks, I'll come to know a group of remedies and with which I'll start. And bladder, urination, voluntary. As I said, most of the kids are wearing Pampers, so it is typical, diapers. They are wearing diapers. So sometimes we get it marketed, and sometimes it may be ignored. And for the temper tantrum children, teeth clenching, teeth together desire. They'll be just biting teeth whenever they get angry and irritable. So when we see the case taking protocol, they'll be giving you lot of stories. I will be 4 pages. I'll be complete taking in this method. So firstly, I pay more attention to the presenting complaints, because some people, they complain about tantrums. Somebody complained about delayed speech. Somebody complained about toilet training. They wet the pant, always like that. And secondly, diagnostic symptom, the 3 symptoms: eye contact, name calling, and speech or sitting tolerance. And then antenatal history. So this regression history, why we need regression history? Because then only we can treat the childhood disintegrative disorder. And then, as I told, special cravings. They'll have somebody eat, chalk, mud, like that some cravings are very erratic in these children, and abuse of medications. Only by paying attention to all these information, I'm working out the cases and I'm getting 70 to 80% success. So as I told, this pervasive development disorder, it is little bit difficult for me to give some sort of relief or improvement, but it is time taking. I don't say that it is impossible with homeopathy, but in pervasive development disorder, it is little bit time taking to show some sort of improvement. If the parents are very much cooperative, then you can take up pervasive development disorder. Otherwise, they don't give us much chance. They wait for only 1 month and then they'll be changing the doctor. But some patients, they'll be coming back again after 3 months or 6 months. But by the time would have been played, and it can't do much. Okay. So these are about my experiences, and I would like to share a case. So this girl, she was 2019 born. She is the second child, and she presented with a complaint of, there is no speech, no eye contact, no sitting tolerance, nothing. She'll be running, jumping here and there. And mainly why she came to me last week, she pinched someone very harshly in the school. So they thrown her out. They told that we can't keep your child in the school. So the mother was trying what could be done. Then the psychologist, they referred to homeopathy. Better you can take some treatment and change her, this behavior and all. So after taking the preliminary data, I found that these mind symptoms, she doesn't fear for anything except the fear of darkness. If there is a power cut, she suddenly make noise and go catches the mother. Otherwise, she don't come to the mother, don't ask for anything, not even food. She doesn't come and ask. She don't know how to eat. She don't convey her urine or stool reflex. This is the state of her, and pinching mania. And her cravings, it is about eggs, milk, and sour foods. So when we asked the mother, she was delivered normally only. It was a full-term normal delivery. There was not much complications except hypertension. She developed a hypertension from the age of me, from the 4th month of pregnancy, and she had very severe vomiting. She had longing for food. The mother was not able to take food, and it lasted until she's going to the labor ward. That's how she told me. Until I'm going to the labor ward, I had vomiting. I was unable to eat anything. So then the child was very normal. She was traveling from the 6th month, and she started walking, teething. Everything was normal. Only speech was not developed. So this my repertory chart, and usually I don't take much symptoms. I refrain with 7 to 8 symptoms. So whatever being open to me, I didn't interpret anything. It could be why this child is, fear about the darkness. Why this child have fear of animals. I didn't do that, research and all. I just took whatever is being shown in front of my eyes. So I had taken anger, the throwing things and pinching, and her restlessness. She's jumping and roaming everywhere. So all these things I had taken, and I found that the remedy was tuberculinum. Most of the time in these temper tantrum, the remedies which I have got for mostly are tuberculinum, belladonna, and stramonium. These three remedies came very frequently. So I prescribed tuberculinum. Initially, I gave in 200 potency. After showing the response, a better response, I have changed it to 0/1 potency. I took the follow-up after 30 days, and the mother was giving these symptoms. We can't expect them to give the exact symptom. Whatever told in the initial case taking, they don't say it has increased or decreased. We don't get such sort of follow-up. Whatever is improved or whatever is troublesome, only that will be conveyed to us. So earlier she had difficulty in recognizing people. Now, whenever some guest come home, especially grandparents, she just go and receive her. So she was so much showing tantrum to get the mobile phone. Always she was asking for mobile, but now she herself coming and giving to the mobile bag. See, these sort of behavior change, it cannot be produced with any therapy, I feel, except the homeopathy. And she has, showing tantrums for touching. Whenever she is aggressive, mother try to hold her and to pacify her, but she never permit that. She never permit anyone to touch her. But now she's playing with the brother and all. So, and overall, her mood is very good now. She's very normal and smiling always. So after a period of 20 days, now she has been taken up in the school again. And the most important is speech. All the parents, they are more focused on the speech. They are coming with so many symptoms, but they want the speech to be developed. So now they are insisting me, I want to see the child speak normally. Okay, so she has started telling few words at all. So this is for before treatment. You see, I asked, show some photos of the child. This is her favorite position, I guess. So she'll be jumping in front of TV. Otherwise, she'll be upside down like this. And this is the report given by the psychologist, autism spectrum disorder with the sensory issues. Now, after the treatment, you know, she, she's like, she's sitting like a saint and reading all those things. Usually, I don't want to disclose my patients. That's why I refrain from showing examples from these kids. Whatever Google slides we have put up, that can be, put up with the cases, but I don't want to expose them because some other day they are going to be very normal, and they'll be very normal in this society. I believe it. So she's sitting sometime, and yeah, this is awesome. She started taking food, and but still she doesn't have that touching the food, eating with hands. It is not developed yet. Yeah, but she's changing now. Okay, so with this we can put the end card. I'm open to your questions. Thank you. Yes. Hello, ma'am. Hello. Hello, ma'am. Yeah. Am I audible? Yeah, I completed. I'm waiting for your yes. Yeah.
Hello, ma'am. Am I audible to you, ma'am?
Yes, yes, yes.
Ma'am, there is a questions
Questions.
from the
Yes,
participants, ma'am.
yes, please.
Uh, Actually, ma'am, I have vernix aphasia patient. How I start speech therapy for this patient?
Okay. So we need to identify, is there any ailments from or any causative factor or any factors that is contributing to this illness that has to be addressed with the homeopathic medicine, and then we could go for treatment along with speech therapy along with. But what stalwarts are telling in introducing speech therapy, it is about their response, it is about their interest. If the patient is willing to undergo speech therapy, better you put them under speech therapy. And most of the time, if we see even these children also, they're not much interested in attending speech therapy, being told again and again. So by giving medicine, so I feel treatment is mandatory in this case. And when they are ready to, ready to speech and accept the therapy, then we can put up for speech therapy. Yeah.
Okay, ma'am. Ma'am, one more question from the participant.
Yeah.
May I know about virtual autism and its rubrics?
Virtual autism. Yeah, I've seen in 3 cases, we found that ailments from. I used to ask in all the cases what was the ailments from. They used to tell that we play rhymes while feeding the child. So when the child was watching the rhymes for 5 hours and 6 hours, suddenly they started crying, and afterwards they stopped watching the television or laptop. And even now, the child is very much scared of checking the mobile and all. But unfortunately, I didn't use any rubric for that. I prescribed, based on the other symptoms. So I'll surely look into it and let you know. Thank you. Thanks for the question. But it is there. It is there. A child, he just throw the mobile phone. From that day onwards, he doesn't look at the mobile. He doesn't even touch the mobile. Yeah, it is there in visual autism.
Okay, ma'am. Ma'am, moving on to the next question, ma'am. Is there any link of ASD with nutritional deficiency?
Nutrition deficiency. Yes, we could say that is why hyperemesis, this hyperemesis gravidorum. What is happening inside? The mother is not taking proper food and nutrition is not being absorbed with the child. So, and in the neonatal period, just after born, so I used to ask about the duration of breastfeeding and when the breastfeeding was started. In cases where the breastfeeding was not given for 2 days or 3 days, or the mother doesn't have proper milk secretion, the children are having this disorder. Yes, we could take it as not as a nutritional disorder. We can take it as a less oxygen supply to the brain. I comprehend in that way. This nutrition in turn lead to poor oxygen supply to the brain. Yes.
Okay, ma'am. Ma'am, you have presented one case, right, ma'am? So
Yeah.
in that, the question is like this, ma'am. In that, the prescription is of tuberculinism. What potency and how many times of repetition has been given? And how do you prefer 50 millismol potency?
Okay. Yes. Good question. So I wanted this question to come up. That is why I added in the slide. I usually give 1 or 2 doses for all the diseases. So the same I applied in this case also. I gave tuberculinum 202 doses. So one at night, one in the morning, and then rest was all placebo. I took follow-up after 1 week. The initial change that I noticed in all these children, eye contact. Whenever there is improvement in eye contact, it is a sign that this case is going to be all right very soon, and a boon is waiting for you. So in this case also, the eye contact, the number of moments and frequency of eye contact has been increased. So I concluded that this child is going to be all right. Then I changed it to 50 millisimal potency. In 50 millisimal potency, usually how I give is I take 500 ml of mineral water bottle. I'll be adding only 1 pill of 50 millisimal pill, into it, 0 bar 1. I usually start with 0 bar 1. And in my entire duration of study, I could say for the period of 1.5 years, I didn't even go beyond 0 bar 3. Within that, the case will be solved actually. So I added 0 bar 1, only 1 pill, and I gave it to the parents. They have to give 10 strokes, 10 strokes every time, in the morning, in the afternoon, and at night. Since it is a no sode, I refrained them from giving every 2 hours or 3 hours. I made it only 3 times a day. So they have to give 10 strokes every time, and they have to give 5 ml from the liquid. So this 500 ml per day, 15 ml the child will be taking, and obviously it comes for a period of 1 month. So along with that, I give placebo, 4 in the morning, 4 at night. This is how I treated all the cases, And in few cases, now the aggression has been reduced. Some people, they come with exhibitionism. Somebody, they come with tantrum after giving stramonium and hyoscyamus. Now the tantrum is over. The child is very calm. He is very normal. And the only symptom is development of speech. In such case, I will take up the next remedy which comes in the repertorial analysis. So that will be usually a polycrest, like a phosphorus, natramure, carcinosin, addressed in many cases. These three remedies comes in almost all the cases, but we have to find the crucial rubric that will help us to differentiate the remedy. So this is a pattern I followed for all the 120 cases. Yes.
Okay, ma'am. And ma'am, actually, the question over here is there any link of autism disorder with nutritional deficiency? They want to know the link, ma'am, with that nutritional deficiency, whether there is any link or not.
Yes, there is a link that leads to poor nutrition, blood supply to the brain, and the child is becoming autistic. Yes.
Okay, ma'am. And based upon the observance also, as you said, observance of the nutrients in the body, etc., which are required for the development at the
Yes.
stage.
I would like to pinpoint that this nutritional deficiency in the antenatal period or in the neonatal period. It is
Okay,
not
ma'am.
that once the child is born, afterwards we have not given proper food and all. That is why the child became autism. No, not like that. It is with the mother. And in the neonatal period, poor oxygen supply to the brain. So these two things directly contributes for autism. Yes.
Okay, ma'am. Ma'am, actually, we need your consent to share the PPT for the participants, ma'am. They are many of the participants are requesting the PPT, ma'am.
Yeah, sure. I'll do that. I'll share it with you, and I would like to do a few modifications like adding references that will be more helpful to them, where to find
Okay.
all these data and all. Then you could share it.
Okay.
Yeah, not a
Yes,
problem. Mm.
sure,
Yeah.
sure, ma'am. We'll be sharing to them. Respected
Mhm.
participants, kindly join in our WhatsApp group to have all the PPTs. We'll be sure shared in that. Yes.
Yeah, and I would like to add up some more. If you are more interested to learn more about autism, we have some short courses for autism also. You can join and get benefited out of it. Yeah. Mm.
Yes, ma'am.
Yes, yes. Thank you. Thank you all. Thanks for the cooperation and thanks for patience in listening. I hope this 1 hour is very useful to you, and please make it more and more useful in serving the special children, in serving the other side of society. We all are talking about, I have this problem, that problem, financial worries, this and all, but daily life is very, very miserable. For mothers of autism children, special children. So please try to help them enormously in your area, India wide, worldwide, wherever. Just we have to have a lot of knowledge about it, so we can easily succeed with the help of homeopathy. I wish you all the very best. Thank you. Thanks for the opportunity. Thank you.
Ma'am, kindly share us regarding the courses also, ma'am, because some of the participants are asking regarding the information also.
Yes, ma'am. Yes, I do, ma'am.
Uh, okay. Thank you, ma'am. Thank you so much for enlightening us with the wonderful session. We are very delighted to have this such wonderful session and to have you also. Thank a special thanks to you, ma'am. Thank you to all the participants for the active participation. So, as you all know, there is a conference which will be going to held. So, there are many competitions which you guys can be participating. Entire details will be given in the WhatsApp group as well as the uh, in all the media. So kindly check it out in all the social media groups which we have be posting in the WhatsApp group. So hope you guys will be enjoying all the webinar series for the further also. Thank you all. Thank you so much, Team Aisha. Thank you all. Good night.
Yeah. Thank you. Thank you. I'm signing off. Bye. Bye.
Thank- thank-